Hi, this is Nurse Casey, one of the medical advisors with Premom. Don't forget to like and subscribe to our Premom YouTube channel so you can be in the know when we post videos of anything TTC related that is going to help you on your journey. Today, we are talking about polycystic ovarian syndrome, also known as PCOS. For those of you who don't know, PCOS Awareness Month is September. So this month we're actually celebrating PCOS. We're educating about it, learning signs and symptoms and what to do if you were to be diagnosed, treatment options, PCOS with pregnancy, all of that good stuff. So I hope you guys stay tuned to learn all about PCOS today. Polycystic Ovary Syndrome, PCOS, what is it? PCOS is a hormonal disorder that affects the ovaries. It's characterized by a hormonal imbalance that can lead to a whole range of symptoms, which we're going to get to next. One of the key underlying factors with PCOS is actually something called insulin resistance, which affects how the body processes glucose, also known as sugar, and can lead to elevated levels of insulin within the blood. So these elevated levels of insulin in the blood can in turn contribute to the production of excess androgen hormones. An example of an androgen hormone is testosterone, and this can lead to a whole nother variety of symptoms as well. So you'll notice that when you do go in for testing, which we'll talk about in a little bit as well, when you go in for testing for PCOS, your either primary care or OBGYN, who's ever ordering the blood work, is going to order a testosterone level for you. That's one of the hormones that you may notice is elevated with women who do have PCOS. So let's talk about signs and symptoms of PCOS. How would you even know that you have PCOS? What is something that you should be looking out for? When should you talk to your doctor? Let's answer all of these questions. So PCOS often manifests with irregular periods or even the absence of a period at all, which is called amenorrhea. So a lot of times what happens with PCOS is that you're either ovulating much later in your cycle, which is going to delay your period, or you're not ovulating at all, which is going to cause an absence of your period, also known as that amenorrhea. So just because you have an irregular cycle doesn't mean that you have PCOS, or just because you have PCOS doesn't mean that you're going to have an irregular cycle. So hopefully that makes sense, but not everyone who has PCOS has an irregular cycle. This is just a very common symptom to look out for. This is just something that you definitely want to keep track of, which is why it's so important to be tracking your periods, tracking your ovulation. You can use ovulation predictor kits to know if and when you're actually ovulating, and that tells you when to expect your next period. Another common sign, as we discussed earlier, are those elevated androgen levels. So those elevated androgen levels, which can be seen as through like elevated testosterone, can have symptoms such as like excess facial hair, excess body hair. You may notice some acne, you may notice some weight gain, or just some male pattern baldness as well. Also, despite its name, PCOS, which is polycystic ovarian syndrome, sometimes we'll have visible cysts on the ovaries. So it's really important that you actually get an ultrasound done with your provider, because that can show you that there may be cysts on the ovaries, or that your ovaries may appear enlarged and contain numerous small follicles. All right, a question so many of you have asked this before: how do I get diagnosed with PCOS? How do I even know that I have PCOS? Okay, so as we mentioned before, PCOS can be very complex. It has a whole list of symptoms that can actually overlap with other conditions. Again, as I mentioned earlier, irregular cycles. That doesn't always mean that you have PCOS. However, it's a very good first sign that you could have PCOS. So what you want to do is go to your healthcare provider. They're going to look at your medical history, they'll do a physical exam, some hormone testing through blood work, and they may even do a pelvic ultrasound. So let's talk about those 4 ways of a possible diagnosis. First, I said clinical evaluation. So you're going to either call your OBGYN, your main healthcare provider. You want to talk to them and say, hey, I'm having these symptoms XYZ. I want to come in and talk to somebody. So they're going to take a medical history based on your cycles. We want to know, how often are you having your periods? Are you ovulating? Is there like 30 to 60 days between periods? Maybe there's 90 days between periods. Do you have any other symptoms? Or is there any family history of PCOS or any other related conditions? Number 2 would be a physical examination. So just looking at the overall patient themselves, seeing if they have any of that extra facial hair we were talking about, any acne, any changes in the body weight that will be assessed, like quick changes in body weight, things like that. Number 3 is going to be hormone testing. So again, testing those hormones is super, super important because that can give us a lot of information about what's going on within the body. So we want to look at testosterone levels. We want to look at your insulin levels. We can also look at your reproductive hormones like your LH, FSH, estrogen levels, all of that good stuff. And that's done through blood work. However, you do need your doctor's order to have blood work done. So again, that's why it's super important to make the appointment with either your OBGYN or primary healthcare provider to discuss all of this so they can order this lab work for you. And then number 4, as I mentioned, is that pelvic ultrasound. So this is just an ultrasound done where we just look at your ovaries. We want to see, what do they look like? Do you have multiple small follicles? Do you have all of these extra cysts going on? We want to know, how do your ovaries look in general? Do they look like someone who may have PCOS, or maybe they don't? So again, those are 4 ways that you can go about getting diagnosed. The most important thing to do is contact your provider to get that appointment scheduled, because you want to be able to talk to someone and have all of this blood work and ultrasound and all of your history and everything ordered from them. All right, treatment options of PCOS. This is another super common question that we get very often. And we're going to discuss just a couple of different treatment options, talking about your lifestyle modifications and actual medications. So when it comes to lifestyle modifications, you really want to adopt a healthy lifestyle with regular exercise and a balanced diet, because those 2 things can really improve that insulin sensitivity that we were talking about and overall help with the balance of your hormones. So many people with PCOS actually find it helpful to work with a specialized PCOS dietitian to help them meal plan, figure out what works best with their body, and to keep those sugar levels stable. So super important. Not everybody does, but it is a recommendation that some people find it super helpful to work with someone who is specialized in PCOS. Another option is medications. Again, super important that you talk to your primary care or your OBGYN about this, because obviously they have to be ordered through your physician, but this is just some available options. So you could be the hormonal contraception, so birth control pill or IUD, something of that sort. If you're not trying to currently get pregnant, right? That can help regulate your periods and reduce any of that excess androgen that's going on. You also can have anti-androgen medications like spironolactone that can help manage any extra hair growth or acne. And there's also a medication that can help with your insulin sensitivity, and that's called metformin. So that we see a lot of people being managed on when they do have those extra symptoms with PCOS. Now, when it comes to fertility treatment for those trying to conceive, some people may actually need a medication to help them ovulate. Because remember, a lot of women with PCOS are not ovulating or have delayed ovulation, meaning it's really hard for them to conceive. They don't know when their fertile window is going to be. They're having very long cycles. So finding that fertile time can be very complicated for them. So going to your doctor and discussing things like Clomid or Letrozole that may be prescribed to help induce ovulation. Sometimes people may need to go towards IVF. That might be considered, but typically that's not the first step. So you definitely want to talk to your OBGYN about that, or even go to a fertility specialist specifically to talk about trying to conceive if you do have PCOS. Conceive with PCOS can be a little difficult just because ovulation can vary slightly with PCOS. So some people have longer cycles, meaning their ovulation may be a little bit more irregular and harder to find. So what do I recommend when trying to conceive? I want you to use Premom, the Premom app. It is a free app where you can use your ovulation predictor kits, scan your ovulation predictor kits with the Premom app to easily keep track of all of your testing strips. Premom is a great resource to use when trying to conceive, especially if you have PCOS. It's just as helpful for any person trying to conceive, especially when you're using your ovulation predictor kits, right? So that is the whole goal here, is that we want to know when you are ovulating. That is the best time to be having sex, is during that fertile window. So how do we know that you're ovulating? We want to see that rise in luteinizing hormone. We want to find that LH peak where your LH is going to go up. With PCOS, you may find that you have a little bit more of an elevation and the luteinizing hormone, where your baseline just might be a little bit higher than normal. So when it comes down to tracking, you may find that maybe you're getting a couple of different LH surges, right? So using Premom allows you to track all of your luteinizing hormone tests, all of your ovulation tests from every day that you're testing, and it keeps them in one place. It also is going to graph them for you so you can easily see what your LH is looking like throughout the cycle and identify when you're having that LH peak, because you can clearly see your LH levels going up. So I recommend Premom to anyone who's trying to conceive, especially if you have PCOS. It can be very helpful for you. So let's wrap it up. Polycystic ovarian syndrome, PCOS. It is a complex condition that affects many individuals physically, emotionally, and we learned today, reproductively. So recognizing the symptoms of PCOS, looking at your own cycles and noticing, hey, is this something that may be happening with me? Seeking early diagnosis, going to your OBGYN or your primary care provider, asking for that testing that we discussed, exploring your treatment options, whether you choose to go toward the hormonal birth control route, if that's something that maybe you're not ready for trying to conceive yet, or maybe you are TTC and you're looking for help with ovulation. You have different options there, so it's very important that you just understand what your options are, because that can empower you as an individual with PCOS to just take charge of your own health. So understanding the unique challenges of PCOS just allows you to embark on this journey to parenthood, if that is your choice, with confidence and support. So just remember, the one takeaway from today, and that I hope that you learned from me, is that every PCOS journey is different. We are all unique. Everybody is different. My journey does not look like your journey, who does not look like your friend's journey. Even though you guys all may have PCOS, each journey is still unique to you guys. So best of luck to you. I hope that you guys enjoyed this video and that you took away something and that you learned something from this. So don't forget to like and subscribe to our Premom YouTube channel so you don't miss out on any fun and new videos that we post.